Today, it is my pleasure to introduce Professor Sheila Tlou as the second keynote speaker today. Professor Tlou is a special ambassador to the African Leaders Malaria Alliance and has previously served as the Minister of Health in Botswana. She has led fundamental work on the role of nursing, women's health, and gender issues associated with HIV and AIDS in Southern Africa, with a particular focus on improving policy. Today, she will speak on African Leaders Malaria Alliance 4-point agenda in the fight against malaria, linking policy, accountability, and action to science. Thank you so much.
Thank you very much. Let me greet you all, my dear colleagues in the Global Malaria Response, and say good morning, good afternoon, good evening, depending on where you are. Now, I'm actually thrilled to be joining you to mark this important day when we reflect on malaria, celebrate the progress that we have made, and indeed consider the challenges as we continue to work towards malaria and elimination in Africa. I must say, I want to really thank the speakers of the first session. They were really great in showing us how research can actually be translated and applied at community level for malaria elimination. And I want to encourage you that as you do that, please make sure you involve members of parliament. I had a session with ECOWAS members of parliament on their role in malaria elimination. And part of the real plea was, please share the studies with us. We know, they said, we know some of them published in these international journals, but they could at least summarize those studies for us so that we can be able to lobby and ensure that there are resources available. So please do that. And indeed, my belief is that health is made at community level. Hospitals are for repairs. Not only that health is a political choice, but that political choice has to be accompanied by data from US researchers. So I am particularly pleased to be participating in this conversation about translating science into practice. And I really want to express my deep appreciation to the scientific and research community for the continuing critical role they play in the fight against malaria. Indeed, through data and evidence that is generated, we are able to make informed decisions. So allow me to highlight some of the linkages between science and policy leadership for malaria elimination in Africa by sharing Alma's 4-point agenda in the fight against malaria, where we are looking at linking policy, accountability, and action. Alma, which is the African Leaders Malaria Alliance, is a coalition of African Union heads of state and government working together and at that level to fight malaria. Our leaders are committed to ridding the continent of this disease, which costs us over 600 lives and $12 billion in GDP every year. They appreciate that malaria elimination is essential to the achievement of Agenda 2063 and to the broader achievement of the SDGs, not even limited to, but including SDG 3, the health and well-being. Alma's work, therefore, revolves around creating an enabling environment for the fight against malaria, as well as overseeing and responding to progress. As such, our chairperson, President Uhuru Kenyatta, has defined a 4-point agenda to guide our work at Alma. The first being digitalization and real-time access to data by improving access to malaria data through a digital platform using scorecards to empower action. Second, establishment of malaria councils and funds to mobilize additional domestic resources for malaria programs and engagement of country leaders at all levels and across all sectors. Third, recruiting a new generation of malaria advocates, the Youth Army, to champion malaria control and elimination. And lastly, sub-regional coordination that entails work with African regional economic communities and heads of state to drive malaria elimination at that level. Alma has worked with 40 endemic countries so far to develop country-owned malaria scorecards for action and accountability. and these use routine data to track performance of priority indicators. The scorecard tools provide a mechanism to continuously monitor progress towards national malaria strategic goals and to identify and to act on bottlenecks. The scorecards broadly track implementation of policy, including coverage of malaria treatment and prevention interventions, indicators of disease burden, as well as other indicators that are necessary to achieve progress towards control and or elimination. Scorecards are updated and discussed every quarter by the leadership of the Ministries of Health, and I'm hoping some of them are right here with us, with the national and local as well as non-political leaders and communities. In addition to national continental Alma scorecards for action and accountability, we track policy priority indicators at continental level. Furthermore, regional scorecards are implemented at regional economic community level and are also being prioritized to widen engagement for malaria elimination at this level. That's why I was telling you about my colleagues that I work with, the members of parliament of the ECOWAS region. The scorecard mechanism complements the work done by scientists who develop and test the tools that are integrated into country malaria responses. And the scorecards enable a simplified, evidence-based system for stakeholders to monitor implementation of malaria policies, which come directly from the scientific recommendations and highlight the successes and challenges to progress towards malaria elimination. For example, the Alma Continental Scorecard, which is presented to heads of state and government during African Union summits, tracks malaria resistance to the 4 insecticide classes currently used for IRS and LNIN. In so doing, the scorecard has played an important role in highlighting to Africa's leadership the widening, the performance of medicines and really the widening gap that could be there in when we consider what needs to be done. And we are able to also, the scorecards are very useful in highlighting real-life challenges of implementation of otherwise efficacious tools, mainly because the scorecard process includes a detailed bottleneck analysis to identify the causes of poor performance. For example, although we have had efficacious medicines for malaria treatment, as has been stated in the previous speakers, and this may be reflected in a scorecard of low coverage, we are able to actually see that countries still struggle with delivery and uptake of these interventions. And this may be reflected in a scorecard of low ACT coverage, treatment or high case fatality rates. And indeed, we have also touched on the issues of poor supply chain management. Issues such as poor health-seeking behaviors and other community-related barriers, as well as health system shortfalls, are well identified in the scorecard discussions. Indeed, some of these issues should feed up to the scientific community for further research, such as to refine the interventions and to identify more effective delivery mechanisms using the lived experiences of communities. As we said, communities do matter, and sometimes their mechanisms may be different from ours. Now, to enable countries to showcase the work they've done using the scorecards and to widen transparency and participation around malaria control, President Uhuru Kenyatta launched a scorecard hub in 2021, where countries can publish their scorecards and for public access. The hub also publishes case studies and the use of scorecards and galvanizes a community of practice around the scorecards. To ensure that the existing tools work optimally and to facilitate development of additional high impact tools that will take us to elimination, the malaria response requires sufficient and predictable financing. and commitment at all levels. So adequate financing and commitment will enable us to address the challenges that we are aware today and the ones that we will have in the future. Indeed, the need for consistent advocacy and resource mobilization couldn't be clearer than today when we are faced with the impact of COVID-19. We had a reported 47,000 excess malaria deaths in 2020 as a result of the pandemic. It is only because of the strong advocacy, commitment, and partnership of endemic countries and global partners that the resources were quickly mobilized to mitigate the COVID impact and to avert the predicted worst-case scenario of a doubling of the deaths. On that one, we are very grateful. Through these partnerships, essential health services were maintained to the best extent possible, and malaria intervention campaigns were prioritized and reorganized to enable the implementation of COVID precautions. Allow me to specifically recognize the Global Fund, which quickly established the COVID-19 Response Mechanism Fund, enable much of the mitigation that was seen in countries. Resources to recover from the continuing COVID-19 impact, to build resilience in anticipation of future shocks, and to develop shock-proof tools are of utmost importance. And this is also one of the assignments for the researchers. Alma plays a major role in high-level advocacy and resource mobilization at all levels. And at international level, we as Alma members actively advocate for and contribute to mobilizing resources for malaria elimination. Indeed, in February this year, our heads of state, in fact, 5 heads of state, Senegal, Kenya, DRC, Rwanda, and South Africa, representing the continent, actually hosted the preparatory meeting for the Global Fund's 7th replenishment. So we are hoping for great success at that level. At country level, Alma is supporting countries to establish high-level multi-sectoral forums to mobilize domestic resources and to rally support for the malaria elimination agenda at all levels. To end malaria councils and funds are playing an important role in resource gaps. For example, in Eswatini, the End Malaria Fund has supported national program to fill community and logistical gaps in implementing case management. In Zambia, the End Malaria Council funded mass drug administration of anti-malarials in specific locations and has enabled an increase in IRS. In Uganda, the End Malaria Fund has funded training of the private sector facilities in good clinical management practices. We anticipate that 30 End Malaria funds and councils will be set by the end of 2022 because we are already seeing great success with them. Colleagues, allow me to conclude by stating that Alma strongly believes that the time to bring the next generation of leaders into malaria response is now. This is for sustainability of the response. Meaningful youth engagement is one of our priorities. And in 2021, the Alma chairperson launched a youth advisory council consisting of 11 youth leaders from across the continent. The council provides guidance on how to mobilize a wider youth movement across the continent. And it participates in malaria advocacy and action events. For example, the Youth Advisory Council supported a Draw the Line Against Malaria campaign during last year's World Malaria Day and hosted an intergenerational dialogue on youth innovation to eliminate malaria during Youth Day in June last year. We're hoping that this year we'll also have something happening. The engagement of youth in malaria elimination also provides an opportunity to identify the next generation of malaria scientists, researchers, scientists, and indeed practitioners. This is an important agenda for the global scientific community. We look forward to continuing to amplify the work of scientists and researchers through supporting the integration of science, of evidence into country policies, and to forming even stronger partnerships between Alma and you, the scientific community of researchers. Zero malaria starts with me. Zero malaria starts with you. Zero malaria starts with all of us. I thank you.